Hi guys, I just wanted to do a quick run through of this course for you. This is the 371 course. You're going to be seeing this video right in here. Dr. Margaret Roberts is going to be your lead faculty, and then your didactic faculty will be whatever section you are in particular. So when you go into users and look at the people that are in there, you will see that you have two different faculty members, one being your didactic faculty member and one being your course lead, who again is Dr. Margaret Roberts. The first point of contact anytime you need something within the course is your didactic faculty member. That would be who you would reach out to. As you can see here, just like you had in 321 and 332, 326, all your first semester courses, you also have your student resources, your course schedule here, links to your technical support, and then course specific support here. So I encourage you to make sure you get familiar with those and navigate this course to understand where everything is. The next spot you want to go is your syllabus, and as you go through your syllabus, you'll see all the information, course description, the credit hours for the course, as well as your textbooks, information on your exams, your clinicals, the clinical case study, lab competencies, etc. So for the course, you have 4 unit exams, which are 10% each for a total of 40%. You have your comprehensive final exam, which is 15%, and then you have weekly discussions at 25%. Excuse me. You also have your clinical case study, which is 10%. This will be similar to case studies that you'll do throughout Surg. One of the things that I will recommend that you do is start looking at that early so that you can start working on it. And if you have a particular patient that you find may be helpful in doing this, or patients that you find helpful in doing this, that you gather that information early and reach out to your faculty members if you have any questions on how to put this together. The key to this is making sure that you clearly answer all of the areas within the clinical case study. You also have 2 lab quizzes that you'll take throughout the semester that are taken right on the Canvas through Canvas here. That may change this semester, so stay tuned, but you do have 2 lab quizzes. You also have Kaplan testing similar to what you had in prior semesters, which is also worth 5% of your grade. Your lab attendance, competencies, and practicum, as well as clinical, are all pass-fail. With this course, this is one of the ones where you do need to have a 77% exam average as well as a 77% course average. So make sure that you're paying attention to that as you go, not just your overall grade, but the grade in those. Your competencies are listed in your lab manual, and for this course, they will be Foley insertion, NG tube, and trach care and sectioning. They are again pass-fail, and you'll have 3 attempts for each of those to demonstrate the skill. Make sure that you understand, again, that lab class is mandatory. The lab quizzes it talks about here. There's information on clinical for you and the clinical dress code, and then your clinical packet. So again, make sure you're taking a look at this and going through and navigating and making sure you familiarize yourself with the information all in here. I'm not going to read all of this to you. At the bottom, the other thing I wanted to point out was your grading scale. So this is how the course grading does go. And then again at the bottom, it's going to have all of your due dates for everything again here. So make sure you navigate the syllabus, look at it, review it, and if you have questions, reach out to your instructors. Again, this is going to be set up very similar to other courses that you've had. You're going to go to your Start Here area, and that's going to have a lot of information about the course. Again, it's more information on technical support, and you should have your information in here with contact information. So then going back here again, we have your syllabus. There's some tips for success. There's additional course resources. There's a link to your exams on here. When you click on here, it'll tell you when the exam is and what it covers. Important area to be looking at. As we go into the modules, so again, you can look at all of these. You have your Ask the Professor area where you can ask questions. There's lab information, clinical information. Each of your modules you're going to click into. It's going to have information in here. So the key reading from your textbooks are right here. These are all things meant to support and help you in understanding the information. As with the prior courses, you're also going to be getting active learning guides. You'll get a weekly active learning guide that's going to give you more focus and guidance. I would also suggest, as you're doing your reading, that you are looking at the Kaplan Basics book, which you all should be very familiar with at this point, and utilize Kaplan for practice questions because it's a fantastic resource for you guys. The other thing is look at some of the supplemental stuff on there. A lot of you have heard me say, against Professor Pulaski, you've heard me say, make sure you're looking at the Kathy Parks videos. Those are also on the Active Learning Guide, so take a look at those as well. These are also different areas that you can go in and watch videos. You can explore information on ABGs. This is a great website for practicing them. And then again, Evolve, be on Evolve, be active in doing practice questions. And also, like I said, in Kaplan. These are actually practice type situations where you can actually go in and do practice worksheets, practice examples yourself, very hands-on. And then again, there's your link to your discussion board. So make sure that you are looking at this. The rubric for graded discussion, when you, or if you're looking for that, this is directions on how to see your rubric. Make sure you look at that before you're doing your discussion board so you're familiar with it. So I wish you all the best this semester, and you're in great hands. I hope you enjoy the semester, but the one thing I will make sure that I'm going to put in your heads is the last thing I say: utilize your faculty and instructors, your didactic faculty as well as your on-site faculty. You use the tutors that you have. Even if you feel like you don't need tutoring, get in there and start early. But make sure you're reaching out to faculty if you have questions. Make sure you're attending the live sessions. They often have answers to the questions that are going to be on your exams. If it's important, we're going to talk about it and we're going to test on it. So critical is the Active Learning Guide. Look at them, do practice questions, utilize Kaplan, and make sure you're attending those synchronous sessions. So best of luck to you guys, and again, use your resources. Have a great semester.